Well, it is Men's Health Week and life-saving health tests that every middle-aged man should have. Now, British men die 4 to 6 years younger than women on average. This is according to their government figures, but stats for New Zealand men are similar. Alongside being what scientists call the biological destiny, which is actually men are more risk takers, risk-taking behaviour, men simply don't like to go to the doctor. The British Medical Journal report earlier this year revealed that men are 32% less likely to see their GP than women are. The main difference being, as I said before, I think women kind of present earlier, they get better outcomes, and men don't get tested and they wait till things are worse. Men are 50% more likely than women to die of heart disease, and they're also prone to central obesity, which is the visceral fat around the puku, and that's not good. Good news though, guys, even for the Dr. Shy man, it is never too late. There are 5 tests that you should get done, blokes, and the man to talk us through them, good friend of the show, is Dr. Bryan Betty. Bryan, good afternoon. Good evening.
Oh, good evening, Leah. Nice to be here.
Lovely to talk to you. So do you agree that it's changed over the years? Men are getting better to going to the doctor, or is it still a little bit of a kind of, I'll wait till something's wrong, a bit of a macho thing? I'm not sure.
Oh, look, I still think a lot of men think they're bulletproof. Certainly when they're younger, and as they get older, they forget that they are getting older and they need to take note of these things. Men have just got this macho attitude. So I think there is an issue with this, that men are often reluctant to go to see their doctor or their GP. And we know that can lead to problems down the track. And This is a really, really important topic.
Excellent. Thank you, Bryan. And that's why I've got you. Number one, I mean, there's probably lots of tests, but this is kind of what the British Medical Journal was kind of talking about. So the first one is get your cholesterol checked. Now, why is that important?
Look, cholesterol is silent. It's in the body and it can be elevated. Now, the problem with cholesterol being elevated, and all cholesterol is fat in the blood. So traipses around the blood. And if you've got too much fat in the blood, if you think about it, it starts to clog up the arteries, which are the tubes that supply blood to the body. And in particular, arteries to the heart, arteries to the brain, and arteries to the kidney. Now, if they clog up, you suddenly end up in situations where you have heart attacks because suddenly there's no blood supply to the heart, or a stroke where there's suddenly no blood supply to part of the brain, or your kidneys start to pack up. So this can be silent, and this is the problem about it. Unless you go to your doctor, unless you go to your GP and have a blood test, you won't know that's the case. And the thing about this is you can do something about it early. You can lower the cholesterol through medication and lifestyle changes. So knowing this is the case is really the critical thing, and then you can do something about it.
There's good cholesterol, though, isn't there? Is that right?
So cholesterol is quite complex, and it does need to be interpreted. So you may have a slightly elevated top-line cholesterol, but we've got good cholesterol and we've got bad cholesterol. So good cholesterol is sort of referred to as HDL, and bad cholesterol is this thing called LDL. And if that's high, that's a real problem, because that's the one that gets stuck to the blood vessel walls, and that's the one that causes clotting and stops blood getting through. So this LDL is the one that we're really interested in trying to bring down. And you mentioned sort of abdominal fat and that adipose around the abdomen, and that's the one that tends to drive this high, and that's the one that we get very concerned about.
The old muffin top, the old puku,
that's exactly right.
The veranda over the shop. Okay, prostate cancer, Dr. Bryan Betty. I think men still are concerned it's the finger or blood test. I mean, nowadays, you can get at the blood test, can't you? What do you do?
Look, a couple of things about it. It's about the age of 50 you should really start to think about the prostate. And certainly if you've got any problems as you get older with peeing. That is, it's not as strong, or it's not quite as strong as when you're younger. You should be seeing your doctor to get a prostate check.
Yeah.
Now, the prostate does get larger as you get older, but this prostate cancer thing is the thing we worry about. And there's a blood test called a PSA that we can do, and it should, about once a year after the age of 50 is a good thing to do, and discuss it with your doctor. It's not perfect, but it is a good thing to do, and that'll give us an indication there may be a problem. Not in all cases, it may be a problem that needs follow-up and investigation. Now, with that, we often do pop the finger up the back passage. Look, it takes 30 seconds. It's really quick, slight discomfort, but hey, if it picks up a prostate cancer, it's worth doing, because again, prostate cancer is curable, but you have to get it early. And often in the early stages, there's no indication apart from a slightly raised blood pressure, or when we do the finger up the back passage, what we're looking for is an enlarged prostate and maybe little nodules there that indicate a cancer. So, look, guys, you don't like thinking about it, but I say just do it. It's well worth it. And I've had patients of mine who've regretted the fact they never did this early on.
And I can't stress it enough either, Bryan, because my husband actually had prostate cancer, and it was a time for us. So, and, he had all the tests and the PSA levels and all of that. So, guys, you got to get it done, right? And
early rather than late, and think of it 50 years onwards as the time to start to think about it.
Yeah. Blood pressure. What's the importance of checking the old blood pressure?
Yeah, so blood pressure is actually called the silent killer, because we've got no indication our blood pressure will be high unless you actually do a specific, measure your blood pressure at the doctors or the nurses. Yeah. It's the silent killer, because what blood pressure do, if you think about it, the heart and the blood vessels, it's like a closed pressure system. And if the pressure inside those blood pressures starts to go up, inside those blood vessels starts to go up and you don't know about it, it starts to put pressure on the blood vessels. And two things happen. One, if you do have cholesterol running around, it can worsen the cholesterol sticking to the side of the blood vessels. But secondly, they can start to weaken and cause aneurysm and suddenly start to burst. And that can cause strokes and aneurysms in the abdomen. It can cause all sorts of problems. The other place the blood pressure causes a problem is the kidneys. It puts pressure on the kidneys and over time starts to damage the kidneys, and they just don't work as well. The other place is the heart. The heart has to work harder to pump the blood around the body, and it starts to get stressed out and starts to weaken over time, and we call that heart failure. So lots of problems that start to develop over a 10 to 20 year period. If you get in early and treat it, those problems don't happen. In most cases, you can't guarantee anything, but certainly you increase your chances of this type of thing not happening.
And a lot of times, I mean, if you're overweight, losing weight is a good way to bring blood pressure down. Yeah,
so there's two things. Losing some weight, we know that if you can lose 2.5% to 5% of your weight, it improves blood pressure. It's really, really important to do. It also improves sugars. It can improve cholesterol, a whole lot of things it'll improve. So weight loss is really important. And when you think about weight loss, you think about two things. One, doing regular exercise, and exercise.